talk of the lateral compartments. Lateral compartments means the uterus, the cervix, and just adjacent on the side, the right and left. Normally we find fallopian tubes and the ovary. So when this area gets affected, when this area loses space because of the growing endometriotic cyst, now the relationship between the ovary and the fallopian tube changes. Why is this so important? Because when the ovary ovulates, when it releases the egg, the fallopian tube with its appendages, fallopian tubes actually has finger-like projections on the sides. One side of it is attached to the uterus. The other side is lying free so that the finger-like projections are actually sitting on the surface of ovary to pick up the egg as soon as the ovulation happens. See how beautiful the nature is.
Yes, yes.
We like to call ourselves engineers, designers, but nobody can beat nature. Okay, so the finger-like projection, in medical parlance, we call them fimbriae. So these fimbriae, which usually sit on the surface of the ovary to pick up the egg, now, because of the presence of the chocolate cyst, whatever size it may not be actually able to sit on the ovary. So whenever egg release might be happening, though she is releasing the egg, it might not be able to be picked up by the fallopian tube. Fallopian tubes are the rendezvous places for the egg and the sperm to meet. So now the sperm is there waiting for the egg, but egg is not coming.
Yes.
So all these factors together now decreases the fertility. This is just the fertility aspect. The other aspect is the quality of life. Any woman who has a chronic pelvic pain, okay, a pain in pelvis for which there is no, answer as to why she's not having urinary tract infection. She's not having any other abnormality in her back passage. Then why the pain? At this point in time, if the scan is done, if the scan shows chocolate cyst, okay, now we understand that maybe the entire pelvis is in some way, affected by endometriosis. So I was talking about the quality of life. If this woman has been suffering from chronic pelvic pain, if she is suffering from symptoms that arise from her urinary bladder, if she has symptoms that arise from her back passage, the anal canal, the rectum, the frequency to, the urge to have, the urge to pass stools, diarrhea, blood in stools, all these things, in addition to not being able to enjoy sexual life, brings down the quality of life. So though endometriosis is something that affects the fertility, primarily, it ends up affecting every aspect of woman's life. So that is why it is very, very important for us to understand the impact of endometriosis on a woman's general health, her fertility, as well as a large part of her social life. Now let's talk about the surgery to tackle endometriotic cyst.
Yes.
Now this can be done with laparoscopy. As I said, endometriosis makes tissues stick to one another. So even the laparoscopy, the first port that we put in the abdomen might not be that easy because we do not know where the intestines would be sticking.
Yes.
The injury to intestines, the injury to omentum. There is a structure in our abdomen called omentum. It is also called the policeman of the abdomen.
Okay.
Omentum has a fatty tissue. It is very rich in blood supply. Because this is rich in blood flow, it will also have white blood cells whenever there is infection in the abdomen. So whenever any part of abdomen is having any sign symptom of inflammation or infection, this omentum goes there and seals off the place so that it does not spread to the adjacent organ. So this leads to omentum sticking to all places where we don't expect it to be there, including the abdominal wall. So that is why the first port of laparoscopy, when we put it, and the first port is always put blindly. There is nothing to guide. There is nothing to tell us what is inside the tummy. Okay. So the first port placement can become tricky. So any person who puts the port, the surgeon who puts the port, has to be very, very careful as to the possibility of intestines and omentum sticking to the abdominal wall. Once the first port is put, once we see what is inside, then it's easy for us to decide where to place the next port. So the difficulties start with the port placement. Next aspect. Because as I said, endometriosis makes individual organs, pelvic organs, stick to each other. Things are stuck inside. So very carefully, we have to separate these two tissues in their natural tissue plane. When this becomes difficult, it involves some tearing of the natural surface peritoneum. Peritoneum is a structure in our abdomen which covers almost every organ.
Okay.
It ensheaths it. Okay. And peritoneum can also have microscopic lesions of endometriosis, which we can't see with our naked eye. So even if we remove the big chocolate cyst, the disease is still there in the endometrium. So once we close the abdomen, it will still grow. That is why I said endometriosis is a chronic process, because you don't know what all, where all, how all it is present. So any surgical procedure done, we can never be sure. You can remove what you can see. What you can't see, you can't tackle. Simple, isn't it? So when we are in the process of separating the stuck tissue, some shearing off, some bleeding, some damage can happen. If this damage involves the urinary bladder or the intestines, it can be a big trouble. It can lead to bleeding inside the abdomen. Okay. So it is technically challenging sometimes to separate two stuck organs.
Yes.
And when we are able to reach the endometriotic cyst, the chocolate cyst successfully, then it has to be taken out in a manner where we minimize the damage to the ovarian tissue. Now, when we are in the process of removing, there is a use of electricity also inside. We call it diathermy, to seal the bleeding vessels. When we use diathermy, it is also going to affect the ovarian reserve negatively. It is, after all, energy, electrical energy, which is going to produce heating.
Yes.
So this heat is going to destroy follicles. So if you allow the chocolate cyst to remain inside, then also it is going to eat away on the ovarian reserve. And the process of removing it is also going to eat away the ovarian reserve.
So you lose either way.
Yes. So that is why when we use diathermy, we have to continuously irrigate the tissue with cold, sterile saline solution to keep the surface area cold. Okay. At the same time, this will minimize the oozing, the bleeding. And while I'm doing this, I also need to look at minimum damage to the ovary. So it is like a trapeze. You must have seen a trapeze artist doing trapeze in circus. The timing, the technique, the approach, everything is important. Okay. And while removing, many a times the chocolate cyst bursts, releasing the contents into the pelvis. Now we see brown, gooey content, just like chocolate sauce, entering the pelvis. So that tissue, that secretion because it contains blood, cannot be left inside. So it needs to be irrigated. The entire area needs to be cleaned off it.
Mm.
Okay. If
Mm.
even little bit is left inside, it may cause irritation to the peritoneum,
Okay.
and the tissues again become stuck to each other.
Mhm.
Blood in the abdominal cavity is an irritant, whether it is fresh, whether it is old.
Mm.
Okay. So that is why any laparoscopy, or for that matter, even laparotomy for endometriosis, is an exercise which should tick all the boxes that I just spoke.
Mm.
Okay. And in spite of doing the best job, these cysts can recur.
Yes.
Any repeated surgery is going to decrease the ovarian reserve drastically. Any woman who has endometriotic cyst in her ovaries is, if I talk of the spectrum of endometriosis, any woman with endometriotic cyst is more towards the severe spectrum.
Okay.
If the endometriotic cyst size is smaller, say for example 1.5 centimeter, or for that matter even 2 centimeter, and if it is present only on one ovary, with all the other structures free, not sticking to one another, maybe there is a chance that she may conceive on her own, or maybe a less complex treatment can work to make her pregnant. But if the size of the chocolate cyst is bigger, or if it is present in both the ovaries or in each ovary, if there are multiple cysts, then that is severe. In addition to this, if the tissues are sticking to each other, which has disturbed the relationship between the ovary and the fallopian tube, the chances of her conceiving on her own becomes less.
Very limited.
Okay, over and above the diminished ovarian reserve. So this lady ends up needing IVF earlier. Okay, after the laparoscopy, if she thinks, okay, I will see what happens, let me try on my own for next 6 months, I will try on my own to conceive. In these 6 months, there is a chance that endometriotic cyst can come back again.
Yes.
So if in a case of severe endometriosis, if the lady undergoes laparoscopy, the next approach should be to do IVF within the next 3 months.
Thank you so much.
My pleasure. My pleasure.
Have a happy weekend.
Wish you the same.
Thank you so much. Bye-bye.
Bye.